Our first knee technique is that of a medial glide of the patella. Your patella is your kneecap. Many people have an injury to the front of their knee where their kneecap actually tracks to the outside rather than staying on the inside of the knee. This taping technique makes sure that the knee is in line so you don't get any pain through the outside or the front of your knee. I always like to use a hyperallergenic underlay for this to allow the tape to stick more, especially on some people or males with some hair around the knee. Ideally, it would be good for them to get them to shave the knee, however it's not essential. The hyperallergenic underlay goes on first from the outside to the inside of the knee, starting a couple of centimetres to the outside of the kneecap, coming down nice and firmly over to the inside. Doesn't really matter if there's too many creases on this one. From here, about 10 centimetres worth of tape, starting from the outside of the knee, coming over, as you can see, bunching the tape up and applying it down the inside. I usually use about 2 or 3 strips for this technique. For the second piece of tape, I like to allow a little bit more bunching of the tape and applying a little bit more force. And on the third one, really making sure the kneecap's gliding towards the inside. And that's the medial glide of the patella.